I'm Sandy, your student nurse. Can I get an SBAR report?
Hi, Sandy. Yes, I'm Lisa, the nurse taking care of Miss Marta Yarn, and she's in room 640 bed B. She came in this morning from the emergency room with a non-healing sacral ulcer for 3 months, which she had recently been treated as an outpatient with no success. She has no allergies. She's a full code. She's an 80-year-old female. Patient Dr. Jolly, and they're going to do a sacral debridement tomorrow. Her background, she's had multiple admissions for pneumonia and dehydration. She's hard of hearing. She has limited visual acuity, watery eyes. She uses a walker. Her assessment is her lungs are clear to auscultation. Bilateral upper lobes, bilateral lower lobes have diminished anterior and posterior auscultation and bases. Her heart, sinus rhythm, vital signs Q4 hours. She has a wound consult. She's on a regular diet, bowel sounds all quadrants. She's voiding by herself. She does have occasional stress incontinence. Right now we're cleaning her sacral wound with saline and covering it with a hydrocolloid dressing. She has no allergies, but her blood cultures came up positive for E. coli in the emergency room, so we're going to treat her with an antibiotic called gentamicin, which it's sensitive to. And also her labs were sodium 145, potassium 3.6, which is borderline low. Her H&H is 12.137, which is a tad low. Her white count's elevated at 12,500, so she does have an infection going on. Okay, her wound is stage 3, decubitus ulcer, so she needs to get that fixed before she is discharged. So, all right.
I just have a few questions to ask.
Yes.
Why is the client receiving this medication?
Like I said, her blood cultures came up positive as E. coli, which is the bacteria. So we're gonna gentamicin is bactericidal, so it's gonna kill that bacteria.
Okay. And then what action does the medication have in the body?
It kills them, yeah.
Okay.
Kills the bacteria.
When should you question giving this drug?
If the BUN creatinine are elevated, because it's not too good of a IV antibiotic choice to give with elevated kidney impairment. If the peak is too high, which if it's over 10, we're going to question it because she could get toxic.
Does the medication have a therapeutic serum level?
The peak should be 5 to 10, and the trough should be less than 2, and the peak is drawn 30 minutes after the infusion, and the trough is done 30 minutes before the infusion.
Which vital signs should be monitored?
Okay, we're going to monitor her temperature, make sure that it's working, blood pressure, pulse, and respirations.
Which physiological parameters should be monitored when the medication is being administered?
We're going to make sure that she's not showing signs of any anaphylaxis, rash, swelling of her tongue, itching.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
We're going to make sure her call light's within reach so she can call us if she does have signs of anaphylaxis, itching, swelling.
Okay. What interventions must be taught for taking the medication safely at home?
To finish her medication completely, even if she's feeling better.
Okay. What are the side effects and potential adverse reactions?
Okay, well, with gentamicin, she could get vomiting or nausea. She could get a rash, which is severe. She could also have hearing problems because the gentamicin is ototoxic in high doses.
And then, how will you know the medication is effective?
By her temperature should be lowered, and her white count will be going down.
Okay. All right, thank you so much.
Okay, let's go give the meds.
Okay.
Knock, knock. Hi, Miss Yarn. My name's Lisa. I'm your nurse today. How are you?
Good. How are you?
Good.
I'm your student. My name is Sandy.
Is it okay if she watches?
Sure.
We're going to give you gentamicin. Have you ever had gentamicin? It's an antibiotic.
No, ma'am.
Okay. We're going to give it IV. Here's some information, patient education for you. Some signs to watch out for is itching, redness at the IV site. If you start to swell anywhere in your face or your tongue, please let us know, okay?
Okay.
Alrighty, and then the other end, we're going to give you some IV fluids that has a little bit of potassium in it because your potassium was just kind of on the low side, all right?
Okay.
Okay, all right. Let me wash my hands. So, Miss Marta, are you allergic to anything?
No, I'm sorry, I'm not.
Okay. And I'm checking over here, and it says no known allergies in her chart. So I'm also going to look at the MAR and double check, make sure we have the right medication that I pulled from the Pyxis. It says to give her 20 MEQs of potassium with in a liter of normal saline, and that's what I have here. I'm checking the expiration. We're good on the expiration. Expires in 2018. Right dose, right time, right patient. Miss Marta Yarn. Miss Marta Yarn, can you give me your name and date of birth, please?
Yes, Marta Yarn, I'm 80 years old.
Okay. And you're not allergic to anything, sodium chloride. Right dose, right time. Right route, we're going to give this IV fluid. IV. And the dose is correct. It's 20 MEQs right here on the bag. 20
Yes.
MEQs. Okay, I'm
And
going to...
I've confirmed the dose and the drug with you.
Wonderful. Okay, I'm going to enter Miss Marta's ID in here. 59409 05 652. There she is, and we're going to enter this medication code, which is D9. Dr. Ducaps. CC BC
Would you like me to read it to you?
5E. Yeah, sure. C 79 B 0B, right? Here, let's try again. Okay. D, yep. Yep.
D91
Mm-hmm.
B5 AA 83 A 207E.
Okay, good. Alrighty, so the right is she's got the little saline lock in her right dorsal metatarsal. So the side is the right dorsal metatarsal.
Okay.
And the time is 1600. All right, so we're going to go over here. We're going to open up the YouTubing. I'm going to lock it for safety.
Okay. I just have a question about
Yes.
the drug. How can I look up for myself in the future as a student to know that the drugs can be mixed?
Okay, I have a little Davis Drug Guide, which I went ahead and
okay.
I did double check and make sure that my gentamicin is compatible with this normal saline with 20 MEQs potassium.
Okay, thank you.
Okay, so I have all this. I'm going to go ahead and spike it right here. This is safe. Make sure I don't have anything covered here. Right there. Alright, so I'm going to go over and I'm going to prime my tubing. And I'm going to flush, make sure the line's working. Scrub the hub for 15 seconds. Here's my normal saline. Flush. It's doing good. I'm going to leave that on there for a second while I prime this.
So, Ms. Yarn, the doctor's put in a couple of orders that we're going to get started for some, one is an IV fluid and the other is an IV product for you, okay? Okay.
it's primed. No bubbles, checking for bubbles. No bubbles. All right, it's locked for safety. I'm gonna go ahead and, was sterile because I just took it off. I haven't touched anything. I'm gonna just swap this out. There. Okay. So now I'm going to go ahead and load this in the Alaris pump. Blue side to blue. Still locked. Okay, at this point I'm going to go ahead and turn the system on. So I'm going to, new patient, yes.
So first thing, we're going to check the doctor's blood
Med-surg, yes.
fluoride 0.9%.
That's her.
We are back.
So channel select,
Fluoride 0.9%.
guardrail IV fluids, right here. Normal saline with 20 MEQs. I'm going to make sure the dose, the rate is 125 an hour. So rate 125. Volume to be infused, it's 1,000 cc, so I'm going to go down to 950 so I can come back and check it. And then I'm going to start, and at that point I'm going to unlock. Okay. IV's going good. I count 5 drops. 1, 2, 3, 4, 5. There we go. Okay, now we're going to go ahead and we're going to get the gentamicin, which is a piggyback. I'm going to go ahead and check, make sure she has no allergies. There's expiration is good, 2018. I'm going to go ahead and finish my documentation here with the IV fluid, maintenance, IV fluids, normal saline, plus 20 MEQ, KCL, at 125, and my initials. The IV was patent because I checked it with the flush and there's no redness. Alrighty, so everything's good there. I'm going to save that. Alright, so now we're going to go to the gentamicin. No known allergies. I'm going to check this. This is a little thing that we're going to do because we're going to lower the maintenance. Because the piggyback has to be higher.
Okay.
I mean, it's not gonna pass the review.
So I'm going to go ahead and check the expiration. She has no allergies. It's the right dose, right time, right patient, right route. So I'm going to go ahead and put her, it's 80 milligrams and 100 mLs. This is what we have here.
And I'm confirming the dose and the drug.
Okay, so I'm going to
Yes.
put her ID in here, which it's 594 090 5652.
I can read that one.
Okay. All right.
Are you ready?
Yep.
D9,
Mm-hmm.
CC,
Uh-huh.
BC,
Okay.
5E,
Uh-huh.
C7,
Yep.
9,
Mm-hmm.
B,
Yes.
0, B.
Okay. Alrighty, so
Mhm.
right time, right dose, right route, which is IV. We're going to go ahead and get this set up. We're going to use what's called a backflow. I'm going to lock it for safety again. Right here, the little lock. Lock it for safety. This is all sterile. Same thing again, just repeat the process right there, right here. Spike it. Okay, so now we're going to go into the room. Marta, name and date of birth. Or
Yes.
at the
Martha
bedside, I
Yarn,
should say. We're
80
on.
years old.
Okay, no allergies?
No.
Okay, we're gonna hang your IV, check gentamicin, gentamicin. All right, where's the little, we need a little, scrub the hub. Over here, we put it above the pump, right here, this little port. Scrub it.
So if you would, can you read off the ID off your form and the shower?
And then I'm gonna be programming it.
And your ID number?
Okay, what I'm gonna do here is I'm gonna do channel select. Um,
594. I'm sorry, you know what?
I'm gonna do a secondary. I'm gonna do gentamicin, which is 8 to 12 hours. I'm gonna do 80 milligrams. The amount is 80.
So it's the medication barcode.
And 100 mLs. Next, okay, now I'm gonna backwash it.
How was your birthday?
To let it come in.
What about your ear?
It's coming in, so we're good there. I'm gonna go ahead and lock it. I'm gonna hang it up here. And I'm gonna undo start.
Don't sit here and waste an hour. You could record the video.
Plus our ID.
Still locked for safety. And open the clamps. Okay, we're done. I'm going to label it real quick because they expire. Making sure that it's open and infusing. Waiting for 5 drops. Okay, so the date is 4/3/LL, 4/3/LL, and it was 1600.
And what do those stickers do?
Because the IV tubing can be last for 4 days, so I'm just sticking these on.
Our rate is at 125 mLs per hour.
And it's showing a little Aaron line, so I'm going to go ahead and look at it real quick while we're here.
Okay.
All right. Looks good.
Don't let that go in the video.
And I'm going to do
No.
Okay, any questions?
Don't get into the light.
Yes, I do. I have some questions.
Mm-hmm.
Yes, he's gonna look at it.
It's red.
Yeah.
Don't let that go. The door's open. So open the door. Make sure nothing's blocking it. No, don't squish it. Make sure nothing is blocking it. Make sure this is pushed in here. And this is up there. There you go.
Thank you.
Okay. Were there any pertinent pieces of
I'm going to wash my
information
hands.
you reviewed before giving the drug?
I just made sure that her BUN and creatinine were within normal limits and that her gentamicin peak did not come toxic.
Did this information affect your decision to give the drug?
Well, I went ahead and gave it, yes, but if I didn't, if something was out of whack, I would have called the physician first. I'm gonna go ahead and finish documenting here
Okay.
the time. Go ahead, you can keep asking me some questions.
Did this information affect how you administered the medication?
I went ahead and gave it as directed.
Okay. Thank you so much.
IV Gent given, 80 milligrams in 100 mLs. Patent tolerating, and it's 20 gauge IV. Okay, my initials and same. Okay, we're done. Thank you so much.
Thank you.
I'm gonna give you your call bell right here and lower your bed, okay? Call me if you need anything, okay?